So dry powder inhalers are a type of inhaler which is used to deliver medicine to the lungs in children who have respiratory problems, especially children who have asthma. In a dry powder inhaler, the medicine is usually contained in the form of a dry powder and which, when the child inhales, disintegrates into smaller particles and reaches to the lungs. On the other hand, in a metered dose inhaler, the medicine is actually delivered in the form of an aerosol. Now, what are the advantages of a dry powder inhaler? So, a dry powder inhaler is, as you can see, that it can be of multiple types, but all these dry powder inhalers, they are very small and compact in size and they are very easy to carry. They do not require a spacer, which is absolutely required and mandatory in children who require to use a metered dose inhaler. Now, in addition, using a dry powder inhaler is quite easy. It does not require the synchrony between actuation and breath, which is required with a metered dose inhaler. But dry powder inhalers also have some problems. The most important being that when we take a dry powder inhaler, because there is no spacer in between, there is a lot of medicine which gets deposited in the oral mucosa or in the mouth, and that leads to a significant amount of medicine getting absorbed in the body. Now, in addition, the other problem which we see with dry powder inhaler is that it requires good inspiratory flow. So the child should be able to generate significant amount of air pressure to take the breath in so that the dry powder inhaler would work. Now this sometimes may not be possible in young children, and hence dry powder inhalers are best avoided in children who are less than 8 or 10 years of age. So overall, dry powdered inhaler, they are a good mean of administering medicine in children who have asthma. The choice of the device, whether it requires a metered dose inhaler or requires a dry powdered inhaler, depends on the choice of parents, the need of the child, the age of the child, what medicine is required. So if your child is having asthma, do get in touch with a pediatric pulmonologist to understand what devices are available and what is going to best suit your child.